Autism, Asperger's syndrome, and pervasive developmental disorder all fall under the grouping autism spectrum disorder. Children and adults with these conditions can suffer from debilitating symptoms. As prevalence grows faster than treatment options, it's important for caregivers to understand their options and for researchers to know what's lacking. So, who has autism spectrum disorder? The most recent CDC estimate is that 1 in 68 people in the United States have autism spectrum disorder, with a ratio of 5:1 males to females. This means that 1 of every 42 males has autism and 1 of every 89 females have it. Symptoms of autism spectrum disorders include social challenges, communication difficulties, repetitive behavior, and physical and medical complications. According to DSM-5, diagnostic criteria include that symptoms must be present in the early developmental period. Symptoms can also include restricted, repetitive patterns of behavior. It can also include hyper or hyporeactivity to sensory inputs. According to a review by Peralta et al., many neurobiological findings support the belief that ASD is a grouping of neurodevelopmental disorders with a prenatal onset caused by many diverse factors. It's most likely a combination of prenatal environment, genetic influences, and abnormalities in molecular and cellular signaling. More than 100 genes have been shown to carry a risk for autism, with no single gene carrying more than 1% influence, which means that gene has a weak effect. A gene called CANTNAP2 has been implicated in abnormal axon growth and guidance. Axons are the tails of cell bodies and are essential for passing information from one neuron to another. There are also common abnormalities in the expression of an important biochemical and are found in the frontal cortex, the parietal cortex, and the cerebellum. The frontal cortex is associated with reasoning, planning, certain types of speech, movement, emotions, and problem solving. The parietal cortex is associated with movement, orientation, recognition, and perception of stimuli. And the cerebellum is associated with regulation and coordination of movement, posture, and balance. There's also been noted excessive brain overgrowth in children with autism between the ages of 1 and 2, and an absence of brain enlargement during pre-adolescence, specifically in the frontal lobe and the amygdala. The amygdala is involved in memory, emotion, and fear. Both types of disconnection suggest that there's a lack of integration of information between different brain regions, which prevents complex information processing and inability to adjust to changing processing demands. Autism was first recognized as a diagnosis in the 1950s, and the first treatment in response to that was called a parentectomy. This was a removal of autistic children from parental custody for long periods of time. It was based on Dr. Bedelman's belief that autism was caused by refrigerator mothers, essentially a mother who didn't provide their infant with sufficient love and attention. This theory was eventually debunked after revelations of falsified data, including studies using children that didn't have autism. In the 1960s to 1965, people started using lysergic acid diamethylide, which is essentially LSD. This was based on the idea that autism is a defect in personality, and therefore the drug was able to alter a patient's perspective and change their personality. In the mid-1970s, aversive punishment became very popular. For aversive punishment, shock therapy was used as a punishment for undesirable behaviors. Children could also avoid a shock by obeying a command. This helped increase positive behavior and decrease negative behaviors with minimal side effects. In the 1980s, auditory therapy became popular, especially auditory integration technique, which was an effort to re-educate the child's hearing and mend deficits in auditory processing. Children were listened to music for 2.5 hours every day for 10 days. This treatment was based on the belief that sensitivities to different sound waves cause behavior and learning problems. In the 1980s and 1990s, psychodynamic holding therapy became popular. This was a physical method that would restrain children and force eye contact with an adult. It was based on 2 different ideas. The first is that autism is based on a poor mother-child relationship, and the second is that relationship can be fixed when the adult physically controls the child. From the 1920s and even today, Biochemical diets are often used as a treatment for autism. So the removal of casein and gluten from the patient's diet is supposed to help symptoms. And this is based on the belief that autism was caused by chemicals in the diet. And this treatment is most successful when paired with other behavioral treatments. Another treatment that's commonly used today is behavioral therapy, or specifically applied behavioral analysis, or ABA. This therapy focuses on teaching motor, social, and reasoning skills. Therapists use careful observation of existing behavior followed by positive reinforcement. They find unwanted behavioral triggers and what reinforces those triggers and works to stop both the trigger and the reinforcement. It's conducted in a one-on-one setting so that the program can be tailored specifically to each child. Currently, treatment options fall on a spectrum about as diverse as the symptoms of autism. Treatments range anywhere from self-healing to pharmaceuticals, but the decision on which treatment path to take is personal to each family. For Martin and his mother Kate, homeopathic medicine provided the symptom relief they sought after. Homeopathic medicine is a medical philosophy and practice based on the idea that the body has the ability to heal itself. It's based on 3 different principles. The first is called the law of similar, and that's the idea that a disease is cured by a medicine that creates symptoms similar to the one that the patient already has. The second is the principle of the single remedy, and that's that a single medicine should be able to cover all of the mental, emotional, and physical symptoms the patient is experiencing. And the third is the principle of minimal dose. Homeopathic doctors prescribe only a very small number of doses of the homeopathic medicine, and then they wait to see what effect the medicine has. After that, the medicine is given in infinitesimally small doses. So back to Martin. Martin was a 3-year-old boy with autism. Over a lengthy observation period, his doctor noted that he had a number of different symptoms. He made minimal eye contact, he was absorbed in his own world, had an uncoordinated walk and full body spasms that his mother would then refer to as a drunk walk. He performed occasional hand flapping, had extreme noise sensitivity, obsession with linearity and lines. He participated in inappropriate social behavior, telling the kids around him that he loved them all the time. He was unable to physically chew by himself and had an aversion to anything new. However, Martin was also a quick learner and had an excellent memory, all pretty common symptoms of children with autism. His doctor then selected the corresponding medicine and started Martin on a detox. Afterwards, she reported that Martin seemed more alert at his 3-week follow-up. The first phase of treatment led to increased speaking, better engagement, more energy, reduced noise sensitivity, and the unfortunate side effect of him telling everyone he saw to F off. But post-phase 2 of treatment, Dr. Fallows saw a significant improvement in speech and pronunciation. Martin began understanding and answering questions, and he was able to feed himself. However, he later relapsed into increased tantrums, reduced eye contact, and an increased obsession with linearity. As the phases continued, Martin continued to make incredible improvements, followed by serious relapses of symptoms. However, Dr. Fallows notes that she's not concerned because in homeopathy, the return of old symptoms is a welcome sign that things will again improve considerably once aggravation subsides. Overall, Dr. Fallows reports that Martin's treatment resulted in improvement in cognitive function, social interaction, language development, muscle strength, sensory sensitivities, and a reduction in repetitive ritualistic behaviors. Some research suggests that the core symptoms of autism are actually the result of abnormal processing of sensory information. Repetitive behaviors and insistence on sameness may manifest because a child is trying to avoid overwhelming sensory experiences. There's also evidence that severe sensory abnormalities correspond with severe deficits in temperament, personality, language, and social development. These observations have prompted environment-focused treatments that acclimate children with ASD to sensory-rich environments. These treatments are called sensory motor enrichment therapy, and they're often used because they're a cost-effective treatment for a wide range of ASD symptoms. There's one study that showed that 6 months of in-home enrichment led to a significant improvement in cognitive ability, reduction in symptom severity, increased IQ scores, a decrease in abnormal sensory responses, improved conversational performance, and in some cases a loss of their classic autism diagnosis. This study was evaluating the efficacy of sensory-motor enrichment therapy. They assigned 50 children, 43 boys and 7 girls, into 3 random groups: a standard care group, a full enrichment group, and a partial enrichment group. Parents in the enrichment groups took their child through 2 sessions each day, each session consisting of 4 to 7 exercises and lasting a total of 15 to 30 minutes. The exercises became increasingly challenging over the 6 months. In the full enrichment group, children may go through exercises like the child selects a textured square that matches the texture of an object in a photo, or they place a coin in a piggy bank using only their reflection in a mirror, or they sleep every night with a scented pillow. In the partial enrichment group, the exercises included the parents drawing lines on the child's face, arms, and legs with objects that have different textures while playing music, the child picking out a colored bead among a plate full of ice cubes, and the child pointing to objects in a book and saying the name of the object. All things that include taking in a lot of sensory information. Children who had sensory motor enrichment therapy saw greater improvement in their test scores, and a greater increase in their average IQ scores, improvement in their responses to sensory information, and 21% of them no longer fit a classic autism diagnosis, although they still remain on the spectrum. It's also very common for patients to go through behavioral therapies. They are treatments that deal directly with modifying behavioral symptoms. 2 of the most common therapies are occupational therapy, ABA therapy, or applied behavioral analysis.
We have a 6-year-old little boy named Christian who was diagnosed at 16 months with autism. His behavior was very aggressive and biting. He would scream at night. He would have tantrums. He was very sensitive to sounds. It was as if his nerve endings were raw, like he didn't have enough fat around his nerve endings. That's the best way to describe it. So if we go to a football game, he just would cover his ears. It was just really tough for him. So got him diagnosed, said he was on the spectrum, and we ended up taking him to Dr. Harris, who is an ABA specialist here in Houston. So he did ABA therapy, occupational speech therapy, and music therapy. ABA was the foundation for everything we did. He was doing 4 hours a day, 5 days a week. When he was first diagnosed, they said that if we did it consistently and the way in which they asked us to do, that he would no longer show signs of autism after a year.
The likelihood of a successful ABA therapy is increased if the child starts before the age of 5. Individuals with autism tend to bond well with animals, presumably because they don't require such complex social interactions. This opens up the opportunity to use animals to aid the treatment of individuals with ASD. One example of this is therapeutic horseback riding. A study involving 3 6 to 8-year-old boys evaluated the influence of therapeutic riding sessions on target behaviors chosen by the boys' parents. The focus of therapeutic riding includes physical, social learning, and psychological goals. Physical goals include things like the student will learn to balance independently at the trot and through transitions. Emotional and behavior goals include things like the student will learn to touch his horse appropriately and follow directions the first time they're asked without additional prompting. Cognitive goals are things like the student developing communication skills with both their horse and their instructor. Typically seen as a more aggressive and risky treatment path, pharmaceuticals are often used to treat children with the most severe symptoms. Currently, there are no known pharmacotherapies for the core symptoms of autism, which are usually the social deficits. And as a result, 27 to 40% of children and adolescents with ASD are prescribed psychotropic medicine to manage severe coexisting symptoms and behaviors. things like aggression, self-injurious behavior, impulsivity, hyperactivity, anxiety, and mood deficits. There are 4 types of commonly prescribed drug therapies. The first is antipsychotics, and there are 2 types of antipsychotics that are FDA approved for treatment of aggression, irritability, hyperactivity, and repetitive or behavioral language in children with autism. The first is risperidone, which is most effective when combined with parent training. However, the side effects are weight gain, dyslipidemia, which can cause vascular diseases like coronary artery disease, stroke, and peripheral artery disease, and hyperglycemia, which is high blood sugar. The second is aripiprazole, which provides more long-term symptom relief. However, the side effects include increased appetite, weight gain, drowsiness, dizziness, and drooling. Children with ASD are often also prescribed ADHD medicine, and there are 2 ADHD medications commonly prescribed to children on the spectrum that also have coexisting ADHD. The first is methylphenidate, which is better tolerated in children with higher cognitive function who are also on additional medications. However, the side effects are decreased appetite, insomnia, and emotional outbursts. The second is atomoxetine, which is also most effective when included with parent training. The side effects of this include fatigue, nausea, appetite decrease, and it takes 6 months to reach its maximum efficacy. Antidepressants are not as commonly prescribed because they're shown to be no more effective than placebos in controlled drug trials. Are not only not proven to be effective, but there's evidence of them being harmful for children with ASD. The side effects include increased energy level, impulsiveness, decreased concentration, hyperactivity, and repetitive behavioral language, and insomnia. In closing, while there are an incredibly diverse range of treatment options, there's still a significant amount of progress to be made. You may have noticed that I often reference children in the studies and data that I talk about. That's because there's a general consensus that in the scientific community that one of the key factors in success of any autism treatment is early intervention. However, this leaves a large hole in treatment and research that's often overlooked. What about adults with autism? There's a problematic lack of resources for adults still living with their ASD diagnosis. Autism also has no known correlation with socioeconomic status, and so for many families, the time and financial burden of treatment can be overwhelming. This often leads families to rely on pharmaceuticals to ease their child's symptoms. But seeing as no autism-specific drugs exist, the side effects can often outweigh the benefits of the treatment. It's important to know the diversity of treatments that are available so that parents are informed, but more importantly, so that researchers know the issues that still need to be addressed in autism treatment.